Good evening. Welcome. We are going to start our event in 2 minutes. Good evening and welcome to our virtual event this evening. I want to start saying thank you to all of you, our participants of the OneDukeGen study. We are very grateful for your support. And please know that we cannot do the work we do without you. The goal we have today for this evening is to learn more about how sleep can affect our cardiovascular health. Before we start our presentation, I want to review some housekeeping details. This event is being recorded, so we ask you that please do not share your personal health information during this presentation. We ask you to please type your questions in the Q&A. If you see in the bottom of your screen, there is a section that says Q&A that has like an interrogation mark. We ask you that please you type your question there and we will answer as many as possible. So if we go to the next slide, I want to introduce you to our guest speaker tonight. It's my pleasure to introduce you to Dr. Paul Campbell. He's a Duke University School of Medicine alumnus. He is a Duke-Kannapolis investigator, and he is a cardiologist at the Sanger Heart Vascular Institute. And he is a great supporter of our work and an amazing friend to all of our teams. So welcome, Dr. Campbell.
Thank you, Cecilia. It's an honor and privilege to be able to talk tonight about a subject that I think is extremely important for overall health, but particularly for cardiovascular health. It's a subject that I'm passionate about, and it's a subject that I at least check on and bring up with my patients when I see them in the clinic every time they come for a visit. So I think we hopefully can get something out of this that can hopefully improve our participants' lives and improve their overall health. So I appreciate being here and look forward to participating. Next slide. So what I'm going to cover tonight is historically what did we used to consider the pillars of health, and how's the hierarchy in regards to those pillars changed based on what we've learned about sleep. Kind of define what is sleep, what are the benefits of quality sleep and good duration of sleep, what are the implications of poor sleep, and what are the deleterious effects of poor sleep on our body, and in particular, break it down into the cardiovascular system, which I think is the most profoundly affected by poor sleep, but also indirectly how metabolism can be impacted, and that also affect the cardiovascular system. And probably most importantly, in regards to our participants tonight, is how poor sleep can affect our DNA and our genes, and ultimately lead to reduced longevity. And finally, end with some tips. What can we do to improve our sleep hygiene to give us healthy sleep and improve our overall health? Next slide. So historically, the pillars of health were defined as sleep, nutrition, and movement, or sleep, diet, and exercise. And that's what I was taught years ago, is what most of us were taught in terms of the most important aspects of health. However, what's been learned over the past 5 to 10 years about the importance of sleep and the profound effect of sleep on our health, it's kind of shifted the hierarchy to sleep being the foundation of health upon which diet and activity stand. So sleep is of paramount importance. Diet and activity are important as well, but we need to be concentrating, I believe, on sleep as a priority. Next slide. Okay, next. So what is sleep? Sleep is a physiological process that allows our bodies to rest, to repair, and to rejuvenate. It has profound implications for systemic health, but in particular for cardiovascular health. And its role extends beyond just the circadian rhythm, that is the night-day cycle, our cycle of hormones every 24 hours, but it encompasses a range of physiological functions that are critical to maintaining vascular integrity, that is the health of our blood vessels, as well as our cardiac function, that is the pumping of the heart, the electrical activity of the heart. Both optimal and poor sleep patterns exert substantial effects on cardiovascular health. And sleep plays a critical role in maintaining healthy blood pressure, healthy cholesterol levels, and healthy weight, which are all critical in terms of future heart health. Next. Okay, next. Can we move the slide forward? I'm not able to control that. There we go. So sleep is divided into 4 stages of sleep. 3 of back one. I think we have a bit of a delay here. 4 stages of sleep. See, can you go back one? Oh, there we go. There we go. So 3 of the stages are called non-rapid eye movement sleep, and that's light sleep, true sleep, and deep sleep. And the 4th stage is rapid eye movement sleep, or dream sleep. And going through one of these 4-stage cycles usually takes about an hour and a half to 2 hours, or 90 to 120 minutes. And typically we go through about 4 to 6 cycles per night, depending on if you're sleeping 8 hours, you may go through 4 2-hour cycles of these 4 stages. For those of you who wear smartwatches or wear an Oura ring or a Ring-Con ring that monitors your sleep, you're familiar with the morning. You see the different times that you're in each one of these stages and how many cycles you go through. Early in the evening is when most of our deep sleep occurs. That's the 3rd stage of sleep, non-REM sleep. Later at the night is when we get more REM, or rapid eye movement sleep. So typically you're dreaming usually in the range of about 5 a.m. to 7 a.m. or 6 a.m. to 8 a.m., and that's your rapid eye movement sleep. It's been determined that optimal duration for sleep is 7 to 9 hours for adults. And analysis of several studies have revealed there's actually a U-shaped curve, meaning there's actually a sweet spot shaped like a U, where if you're less than 7 hours, that's not good. But if you're more than 8 hours, it's not good. We say 7 to 9 as a general range, but you really want to get around 7 to 8 hours because your all-cause mortality will go up if you're not getting enough or if you're getting too much. So not enough and too much are not good things in regards to duration of sleep. Analysis of several studies have shown consistently that persons who achieve optimal sleep duration are less likely to develop cardiovascular disease or have major cardiac events like heart attacks, strokes, and other vascular problems. Next. So this is an image on the left of the 4 stages of sleep, and the percentages are estimates of around how much time you spend in them in each cycle. The blue stages, stage 1, 2, and 3, are your non-REM stages, and the beige one at the far right is your REM, or dream sleep. Light sleep is when you start, you're easily awake and you have muscle activity. The onset of true sleep, your heart rate and body temperature drops some. You have spindle waves during the brain activity. Deep sleep is where you have low amplitude waves delta waves, it's difficult to awaken, and that's where most of your restorative effects or recovery occurs. And in REM sleep is where you have rapid eye movements and vivid dreams. So it's during the non-REM, the blue portion here, stage 1, 2, and 3, that your heart rate, your cardiac output, and your blood pressure actually come down. It's a phenomenon known as nocturnal dipping. And this nocturnal dipping is the key process of the benefit of sleep, the restorative nature of sleep. It's an adaptive process that reduces your cardiovascular workload. It confers vascular protection by decreasing what's called endothelial stress. So your body's arteries are lined by a coating called the endothelium. And the endothelium is very important to protect the integrity of the artery. When the endothelium gets damaged, that's when we start to have plaque buildup inside the walls of arteries. And so we want to reduce stress, trauma to the arterial wall to reduce the chance of having plaque form there. And it also increases arterial compliance. So compliance is the pulsatility of our arteries. So as we get older, the arteries get stiffer and more rigid, and we want to try to maintain this compliance, this pulsativity to our arteries. So this adaptive process, this nocturnal dipping, is what reduces the stress on the endothelial lining and increases our arterial compliance, making the vessels more supple, more compliant. And so this dipping is crucial in maintaining vascular health and reducing the risk of hypertension. It's when the blood vessels get less compliant and the arterioles in our arms and legs crimp down that we end up getting high blood pressure or hypertension. And also deep sleep cycle, stage 3, regulates our autonomic balance. What's meant by autonomic balance is we have two systems in our autonomic nervous system, a sympathetic nervous system and a parasympathetic nervous system. The sympathetic is the stress system where you have fight or flight. You're being chased by a lion, a tiger, or a bear. You want your heart rate up. You want your blood pressure up to save your life. You don't want that happening in a traffic jam when your life's not threatened. The parasympathetic is your rest and digest. That's where you have a slow heart rate, a low blood pressure. Your heart rate variability goes up. And so we really want parasympathetic dominance. And the deep cycle of sleep increases this parasympathetic system, which is the rest and digest system, and it attenuates inflammation and oxidative stress, which are factors which lead to plaque formation. So this deep sleep cycle, this stage 3 of your non-REM sleep, is probably the most crucial in terms of nocturnal dipping, lowering your blood pressure, lowering your heart rate, reducing your cardiac output, and increasing this rest and digest parasympathetic tone. Next slide. So what is poor sleep and what does poor sleep do to us? So quality of sleep along with duration is linked to cardiovascular outcomes. So when we inquire from patients, how long are you sleeping? Oh, I'm sleeping 8 hours. Okay, but are you getting good quality of sleep? And large meta-analysis, which is an analysis of several studies which are combined to increase power based on a large number of participants, has revealed that cardiovascular disease is 16% higher for those individuals with non-restful sleep. It's 22% higher for people that have trouble initiating sleep, that is, falling asleep. And it's about 14% higher for those that have trouble maintaining sleep, that is, they fall asleep, but they don't stay asleep. Any insomnia at all is associated with 13% increased risk of developing cardiovascular disease. And an interesting study looked at the life expectancy of healthy 30-year-olds, men and women, who had optimal sleep. If they have optimal sleep and they maintain optimal sleep starting at age 30, men get an extra 4.7 years longevity and women 2.4 years longevity versus those that have low quality sleep. So if you can maintain good quality and duration of sleep, it can actually give you between 2.5 and 5 years more life expectancy or longevity compared to those with poor sleep. So fairly profound improvement just by having good sleep duration and quality. Next slide. So what are some of the mechanisms? How is it that poor sleep affects our health and what's the mechanisms? These are the five main mechanisms. One is the blood pressure regulation. So poor sleep reduces this nocturnal dipping we talked about. So you don't get the drop in the blood pressure, heart rate, and cardiac output. And this leads to an increased blood pressure or hypertension. Also, with poor sleep, you get inflammatory signaling. That is, you get activation of inflammation. Inflammation is not good. Inflammation in the body leads to damage of our endothelium, that lining of our arteries. And that's why folks that have inflammatory problems have a higher risk of developing atherosclerosis, coronary artery disease, carotid artery disease, disease in the peripheral arteries by the release of inflammatory substances called cytokines. And there's two cytokines that are particularly important. Interleukin-6 and tissue necrosis factor alpha are two of them that are involved with vascular inflammation. That's inflaming the endothelium that leads to this deposition of cholesterol and plaque buildup in our arteries. Poor sleep also affects our autonomic system. We talked about sympathetic and parasympathetic. The sympathetic is only really good if you're in an emergency circumstance. You don't want to have a fight or flight reaction with the release of stress hormones if you're not in that emergency circumstance. And poor sleep leads to a predominance of release of these stress hormones, epinephrine, norepinephrine, which increase the heart rate, increase the blood pressure, and increase arterial stiffness. So again, poor sleep is the sympathetic drive, fight or flight predominance. Good sleep, or that stage 3 deep sleep, increases the parasympathetic rest or digest system, which is what we really want. Another mechanism is the effect on metabolism of glucose and lipids, that is, your fats or cholesterol in your body. Poor sleep affects homeostasis of metabolic homeostasis in that you get decreased sensitivity to insulin. So many patients that have diabetes have what we call type 2 diabetes, and that's usually older individuals that are oftentimes overweight. And the problem is not that the pancreas is not producing insulin, but it's that the tissues are resistant to the insulin that's produced and not able to get the glucose into the tissues, and it remains in the bloodstream. So you get high glucose called hyperglycemia. It also affects the metabolism of our lipids, our fats, and you get high cholesterol, high triglycerides. And finally, it can cause what's called oxidative stress. So our body's main vasodilator is called nitric oxide. You probably see these advertisements on TV for beets and beet juice and beet extract, beet powder. Nitric oxide is our endogenous dilator that dilates our arteries. It's what's released when you take nitroglycerin by any form. It's also what's in a number of different products, and that's what I'm saying about these beet extracts. Nitric oxide is a good thing. It dilates arteries, reduces blood pressure, improves blood flow. Oxidative stress actually reduces the availability of nitric oxide, and poor sleep can lead to that and reduces our natural vasodilator in our body, leading to increased chance of accelerating vascular disease and atherosclerosis. So these are the five main mechanisms that poor sleep can affect us. So how do we look at each system a little bit individually, in particular the cardiovascular system? These are the main effects of sleep deprivation or poor sleep, how it affects our heart and our blood vessels. Most importantly, we've mentioned previously that sleep deprivation increases blood pressure, causes hypertension. Hypertension is responsible for more than 7 million deaths per year related to the effects on heart failure, ischemic heart disease, that's heart attacks and angina blockages, strokes, and end-stage renal disease, folks that end up on dialysis and have poor outcomes. Sleep deprivation also affects our hormonal systems. We talked about increasing the fight or flight hormones, catecholamines. We want to keep those down. That increases heart rate, increases blood pressure, increases chance of atherosclerosis and further problems. It also releases the chronic stress hormone, which is cortisol. So the fight or flight is when you're in an acute situation, you're upset, your blood pressure goes up, your heart rate goes up. Cortisol is your chronic stress hormone that also is involved with chronic vasoconstriction, development of hypertension, and their increased risk of cardiovascular disease. It also affects growth hormones. So growth hormone is very important when we're young, we're growing, we want to get tall, we want our bones to grow. And growth hormone is very important early on through puberty and to get to adulthood. As we age, growth hormone is important in replenishing our endothelium. It repairs damaged endothelium, this lining of our arteries. And sleep deprivation reduces growth hormone, reduces the ability of the growth hormone to repair damaged endothelium, and this leads to accelerated atherosclerosis or buildup of plaque in our arteries. A full night's sleep, good deep stage 3 sleep and REM sleep lead to sending a signal to calm the sympathetic nervous system to reduce our stress hormones. So this is a good thing if we can get good deep sleep and REM sleep, sending a signal to reduce the sympathetic drive. Next slide. So that's the main direct effect on our cardiovascular system. It can also affect our metabolism, which indirectly affects our cardiovascular system. And the way it affects metabolism and indirectly our cardiovascular system is sleep deprivation causes us to eat more, increasing our weight. Weight gain can lead to obesity. Obesity can lead to type 2 diabetes. This type 2 diabetes increases our blood sugar, which harms our organs in the eye. It can lead to blindness. It can lead to peripheral neuropathy, where folks don't have the sensation, normal sensation in their legs and arms, and they can develop lesions, cuts, infection in the legs, and lead to amputations. It can affect kidneys, get kidney disease, peripheral arterial disease, blockages in the carotid arteries, the aorta, the arteries to your arms and legs, and also your coronary arteries can lead to heart attacks and atherosclerosis of the coronary arteries. Also, when we gain weight and become obese, the cells become less responsive to the circulating insulin that's available, and therefore your blood sugar goes up. That's insulin resistance. On the other hand, sleep deprivation actually blocks some insulin release. So folks with type 2 diabetes that have insulin coming out of the pancreas, sleep deprivation reduces the insulin release and also increases the insulin insensitivity or unresponsiveness of the peripheral tissues to the insulin that is released. Interestingly, weight gain wise, sleep deprivation decreases our satiety signaling hormone. So leptin is the hormone that's released that makes you feel full. So when you sit down and eat a meal and you feel like you're satisfied, you've had enough, you go away, you go out and do some other activities, it's leptin that's giving you the signal that you're satisfied, you're full, you have satiety. Ghrelin is the hunger instigating hormone. That's what makes you feel like you want to eat more. So folks that are sleep deprived have reduced leptin and increased ghrelin. And the saying is that a sleep deprived body will cry famine in the midst of plenty. You just ate a big meal, you should feel full, but because your leptin is down and your ghrelin is up, you still want more and you go back for seconds or back for more food. Interestingly, sleep deprived individuals can eat up to 300 more calories a day, up to 1,000 more calories per week, up to 70,000 more calories per year. And that translates to about 10 to 15 pounds per year. So if you're a 35-year-old man and weigh 200 pounds and you're gaining 15 pounds a year, by the time you're 50 years old or 15 years later, you've gone from 200 pounds to 350 pounds. Well, that didn't happen overnight. That happened over 10 years. But you can see how some patients can go from a relatively normal weight to an obese weight over time because of this increased caloric intake over many years. Also, our bodies have chemicals that are produced internally called endocannabinoids. Cannabis is what's in marijuana. Delta-9 tetrahydrocannabinol is the active ingredient in pot or marijuana. It's what makes folks feel high when they smoke it or consume it. And it also stimulates, you heard of the munchies when folks use marijuana. Our own endocannabinoids get released, and sleep deprivation increases the concentration of our endocannabinoids and makes us more hungry, gives us the munchies. So this, in conjunction with increased ghrelin, the hunger hormone, and decreased leptin, the satiety hormone, is a bad brew for gaining weight. So sleep deprivation can affect us by gaining weight, have us become obese, and then that as well directly affects the cardiovascular system. Next slide. Probably of most important to this group, because this is a gene study, and I thought was profoundly important when I first started researching sleep and the effects on the body, is that sleep deprivation can affect our genetic code, can affect our DNA and our genes. So, each cell has DNA molecules, and segments in the DNA are called genes. And as we age, these genes get turned off. We say they become senescent. Senescence is aging. And as we get older, our hair turns gray, our lenses get less thick. We have to get reading glasses. Our spine, we shrink down because we lose some hydration in our discs in the back. And basically, genes become senescent and turn off as we age. Sleep deprivation destabilizes gene expression and can increase the risk of multiple diseases, including the development of dementia, cancer, cardiovascular disease, and autoimmune diseases, immune dysfunction. There's thousands of genes in the brain that depend on consistent and sufficient sleep. So sleep deprivation distorts genetic activity. About half the genes can be revved up and about half the genes can be diminished or shut down. And so this can lead to chronic inflammation, to cellular stress, to heart attacks, to cardiovascular disease, to metabolic disorders, autoimmune responses, and poor cholesterol control or elevated cholesterol or fatty acids in our blood. Sleep deprivation also attacks the physical structure of genes. We have what's called telomeres, which are sequences at the end of our chromosomes, and they protect our chromosomes and our genes so they function normally. When these telomeres get damaged, DNA spirals and genetic codes can't operate properly, and it can actually lead to accelerated aging. So we have what's called our biologic age versus our chronologic age. Next slide. So most of us remember the myth or the story of Ponce de Leon. He was the Spanish explorer in the 1500s who was searching supposedly the New World for the fountain of youth in the Caribbean and in Florida. There was supposedly some spring that if you drank out of the spring or bathed in the spring, you would get youth and vitality. He was looking for longevity. If you look at this graph on the right-hand side, the image on the right, it's basically a graph of chronologic age versus biologic age. And what it is your chronologic age is your birthday. How many birthdays have you had? How old are you? Your biologic age is the age of your DNA or your genes. And one way of assessing this is looking at what's called DNA methylation, which looks at certain age-specific foci in your genes. And we all know folks that are 60 years old but look 80 years old. And there's folks that are 80 years old that look 60 years old. And it's called accelerated aging versus decelerated aging. So you want to have decelerated aging. You want your genes to be kept active, to work properly, to function well, to not become senescent. And the irony of Ponce de Leon is that he was searching for longevity in the Caribbean and Florida when, in actuality, some of the strongest data for improving longevity was in the deck below, in the crew berthing room or crew bunk room where the bunks and the hammocks were, because if his crew was getting 7 to 8 hours sleep, they were probably increasing their longevity more than trying to find some spring water in Florida or the Caribbean. So bottom line is good sleep leads to decelerated aging, and poor sleep can lead to accelerated aging. You want your biologic age to be lower than your chronologic age optimally. Next slide. So many of you may remember Bob Seger and the Silver Bullet Band. He has a song that came out in the 70s called Night Moves. It was an admiration to his days in the 60s, coming of age in the 60s at drive-in movie theaters years before. And one of the lyrics is, working on mysteries without any clues, working on our night moves. Well, actually, we have plenty of clues now about good sleep hygiene, and our night moves ought to be worked on. And the next slide gives you some pointers about how we can improve our sleep hygiene and hopefully improve our cardiovascular health and our longevity. So here's 12 tips for healthy sleep. Number one, stick to a regular sleep schedule. That is, try to get to bed and get up the next morning about the same time so your body gets used to it. Your circadian rhythm is in sync. I typically say, what time am I going to get up? If I'm going to get up at 5 a.m., I need to be in bed by at least 10 a.m. if I want 7 hours of sleep. You want to exercise regularly. Exercise is good for you. Exercise daily is what the Heart Association recommends, but you don't want to exercise too late. You don't want to exercise within an hour or two of going to bed, or you're going to be too revved up to get to sleep or stay asleep. If you're having problems sleeping, you want to try to avoid stimulants. You don't want to have caffeine or nicotine within 8 hours of going to bed. If you're having an after dinner coffee and not sleeping, that's a problem. I wouldn't have the coffee within 8 hours of going to sleep. You should avoid alcoholic beverages before bed. Alcohol sedates folks. They can fall asleep from the sedative effect, but they wake up sooner. They have frequent awakenings, and they don't get good REM sleep. They get absence of REM. So alcohol may actually make you sleepy and fall asleep, but you're not going to get good quality of sleep or stay asleep. So it's not a good thing to be doing to try to sleep. Avoid large meals and beverages late at night. Most of my men patients that are over 65 get up 2 or 3 times because of their prostate to go to the bathroom. But if that's the case, for sure, you don't want to be drinking something after 8 p.m. But you don't want to eat a real large meal right before you go to bed because the digestive process will be active and you may not be able to sleep well. Also, if possible, avoid meds that may delay or disrupt sleep. If you've got ADHD, probably take the stimulant in the morning, not at night. If you've got a cold, it's probably better to take the alpha stimulant, the decongestant, in the morning hours or midday as opposed to right before you go to bed. Don't nap after 3 p.m. Naps are actually good. Actually, naps can increase your longevity, and a nap is not a bad thing. The problem is if you start napping after 3, you may reverse your sleep cycle, and you may end up having poor sleep at night and be awake during the night and start sleeping during the day. And the rest of the world is on the night-day cycle, and it's not going to be a good thing long-term for you. You also want to relax before going to bed. You don't want to be watching bright lights and a big flashy concert on the streaming channel or go in your bedroom and have the TV on with bright lights. You want to calm down, dim lights, relax, maybe listen to some music 15 to 30 minutes before you go to the bedroom. Also, if you're reading on a tablet, you want to read with a dark background and light letters, not a light background and dark letters, because the light background may turn off your endogenous melatonin that helps you get to sleep. Taking a hot bath or a shower before going to bed is also advised if you have trouble sleeping, because you want to have your core and your head cool when you sleep. When you take a hot shower or a hot bath and you get off to dry off, you're cooling your core and your head very quickly, and you're more likely to fall asleep and stay asleep with a cool core temperature and head temperature. You want a dark bedroom, a cool bedroom, and a gadget-free bedroom. Ideal sleeping temperature is actually 65 degrees. Most of my patients tell me they're trying to go to bed at 72, 74 degrees. If you're having trouble sleeping, I recommend they cut the temperature 2 degrees every month to get down at least towards 67, 68. But you want your head and your core cool. You can wrap your arms and legs in the blanket to stay warm. But so these are some simple things that could be done to help sleep hygiene. You also want the room dark. You want to avoid the TV being on, other lights being on. And you want to leave your gadget, your phone. Some people have a phone box. They put it in the box outside the room. You want electronics out of the room if you're having trouble sleeping. You want to have the right amount of sunlight exposure each day. We want our circadian rhythms to be dark and asleep at night and awake with sunlight in the daytime. It also helps vitamin D in your bones. The animal kingdom, most of the animal kingdom goes to bed at sunset and gets up at sunrise. Man is up here because we have electricity, we invented lights, and we're staying up a lot later than most of nature, except for the nocturnal animals. The last thing is don't lie in bed awake. If you fall asleep and wake up and you can't get back to sleep, your mind's going 100 miles an hour. You're thinking about things coming up. If you're just there unable to sleep, get up, maybe read a book, maybe do some paperwork in some dim light until you feel more tired, and then go back to bed. So these are 12 night moves that we do have a clue about that will actually help sleep. And these are simple things I mentioned to patients to consider doing if they're having either poor quality or poor duration of sleep. I didn't mention sleep apnea, which is another major issue. If your spouse or partner says that you're having spells where you're having pauses in your breathing pattern at night and you feel tired and washed out or having other cardiac issues, you may well have sleep apnea. Sleep apnea increases your risk of rhythm problems, atrial fibrillation, of hypertension, of pulmonary hypertension, of coronary artery disease, and heart failure. If that's the case, you should talk to your primary doctor about getting a sleep study, because long-term it can lead to severe pulmonary hypertension, which leads to swelling in the ankles and chronic diuretic use and a poor outcome. For those that are interested, probably one of the best books that I've read on sleep is by a Dr. Matthew Walker, who's the head of sleep and neurosciences at UCal Berkeley. He used to be the head at Harvard. He's got a book called Why We Sleep, Unlocking the Power of Sleep and Dreams. It's a very good reference. It's very informative. It came out about 6 or 7 years ago. But for those who want to learn more about sleep, I highly recommend the book by Matthew Walker. Next slide. So I thank you for your attention. I hope some of this was informative and helpful, and we'd be glad to answer any questions if there's time.
Dr. Campbell, thank you so much, as always. I personally, I will review those 12 tips. I think that I'm going to have more trouble with the one related to my phone, because I think that we are so used to, going to bed with the phone next to us. And the problem is that we use it as an alarm too. So for some reason, it's hard to put it down sometimes, but thank you for that. So now, as you said, we are going to go, to our Q&A session when we are going to answer the questions, of our guests here. And the first question, I'm going to first introduce you to my coworkers, Mickey and Brooke, who are going to be managing the chat. But first of all, I want to welcome our principal investigator, Dr. Svati Shah. Dr. Shah, thank you so much for joining us today. It's a pleasure, as always.
Thank you, Cecilia. Paul, as usual, incredible presentation. You and I have been working together for many years on research projects, and you have a way to distill really complex medical information down in a way that is not only understandable, but actionable, right? So even though you and I are both cardiologists, and I should know what was on your last slide about sleep hygiene, I learned a lot from this talk. The American Heart Association, as you very well know, Paul, used to call it Life Simple 7, right? Control your cholesterol, control your glucose. And just in the past 2 years, changed it to Life's Essential 8. And number 8 was what Dr. Campbell talked about today, which was about healthy sleep. So the American Heart Association really sees this as a critical part of cardiovascular health and longevity. Paul, I had a question for you, which you and I have done research together over the years where people have worn devices that can tell us about the quantity and quality of our sleep. And I was curious, you mentioned sleep apnea, for example. What do you think about these digital devices that may give us more information about our sleep quantity and quality?
I'm a believer. Right? I'm a believer in can't manage what you measure. I actually wear a smart watch and a Ring-Con 2 because my Ring-Con 2 lasts 11 days. This won't recharge every day.
I think we're having some trouble listening to you, Dr. Campbell. Why don't you try just,
see how much they get. That's why I want my REM. Usually my deep. I mean, what percentage? Okay.
Oh, okay. So here, I think we can see you better now.
So I think what I was hearing from Dr. Campbell, and maybe somebody can text him to let him know to turn off his video. What I was hearing from Dr. Campbell is that he believes a lot in these digital health devices. He mentioned two. One was a more watch-based one, and one was a ring-based one. And he was saying, that the ring lasts longer, the battery lasts longer. But maybe I'll put in my 2 cents worth for what it's worth. I think there's a lot of undiagnosed sleep apnea. So Dr. Campbell was mentioning at the end of his talk, sleep apnea means as you fall asleep or as you're sleeping, you actually obstruct your airway. And not only will that make your sleep quality worse, it makes your oxygen levels drop because you're not getting the oxygen that you need. And sleep apnea is one of the strongest risk factors actually for heart disease, abnormal heart rhythms, and honestly just longevity and not dying. So Dr. Campbell, I think, was a proponent of these devices because many of us, either the people or the dogs who sleep in our bed, don't tell us that we stop breathing in the middle of the night. And we don't realize that that's actually happening. And I think sleep apnea is a highly underdiagnosed disease. And these digital health devices can tell us a lot about what the quality of our sleep is and help us understand that. I think another thing that these digital health devices could be helpful for is understanding what the times and the problems might be with regards to your sleep quality. Is it because you're not getting to sleep and it's taking you a long time? Is it because you're just tossing and turning for other reasons and that's why your sleep quality isn't good? Or is it because you're not able to stay asleep and that's why you're coming and not having good sleep quality? So Paul, I was just telling our webinar participants that, it sounded like you were a proponent of using these digital health devices. And maybe I'll just end my question by saying, Paul, I think your talk was very important for OneDukeGen. OneDukeGen, we have gen in there, so people think it's, just about genetics, but it's about prevention, right? And it's about improving people's health. And sleep, I'd say, is, even more important than genetics, even though I care a lot about genetics. So thanks for answering my question, Paul.
Yes, sorry, I got cut off there.
And you have a lot of questions in the Q&A. So Cecilia, I'll turn it back over to you.
Thank you, Spotty.
Sure. And Brooke and Mickey, will be asking the questions, Dr. Campbell.
Okay.
Hi, Dr. Campbell. We've had a couple people ask about how to shut out noise, particularly like if you're in, one person mentioned a nursing home, and it's disrupting their sleep. And relatedly, another person asked about, is white noise effective for helping to go to sleep and block out other things?
Yeah, so they do sell these soft they're kind of like earphones. They're soft and you can roll your head around. They're not the real hard ones. They have a combination ones that do your ear and your eyes as well. Some folks do well with white noise or with calming ocean noise and so forth. A number of folks can sleep better like that. Other folks want total silence, but I don't think everybody. Some folks can actually listen to the radio and fall asleep, where others it doesn't work at all. So I think there are variations for sure, but there are products that are basically either ear and or eye closure device that are soft enough that you can roll around in bed. There's actually some with speakers that I think are soft enough to roll. I don't use them, but they're available. White noise, if white noise works with you, or if listening to calming the sea or rain, waterfalls, whatever works. Oftentimes that's to get people to fall asleep, and then the issue is staying asleep. But there are available products. I would get one that's actually soft and you can roll from the right and left without waking up.
Great. Thank you for those recommendations. We've had a few other people ask about how they can increase sleep when they're waking up during the night. And there's been several different types of issues, from bladder issues to an insulin pump that's constantly alarming overnight. So if you're getting up, is there a way to increase your sleep?
The issue, most of the issue for most people, men and women, is having to get up and go to the bathroom. I say, my next question to them is, what happens when you go back to bed? Are you falling asleep? If the answer is yes, then I advise try to stay in bed longer to get at least 7 to 9 hours. But it's not uncommon at all. For at least most of my men patients are up 2 or 3 times a night, and some of my women patients with bladder issues are also up. I think that the interrupted sleep, obviously, it's not ideal, but at least if you're getting back to sleep when you get back to the bed, then try to make sure you're getting at least 7 to 9 hours total of sleep. No one wants to necessarily have an operation, or you talk to your urologist about trying to go to the bathroom before you go to bed. Don't drink after 8 p.m. at night. But there's still folks that are going to have to get up. I think the main thing is try to get back to sleep and try to get your total amount of sleep that you're actually asleep, not just the time in bed. You may be in bed for 11 hours, but you're getting 9 hours of sleep. You want to look at your total sleep, I would say, and try to get back to sleep and do the best you can. Talk to your urologist if you're having problems there. But the reality is most of my men patients are getting up at least 2 or 3 times a night.
We did have someone who wanted to know if hormones can affect sleep.
Yeah, they can. Folks that are having hot flashes and things like that, it affects your vascular reactivity. Again, I'm depending on which hormones you're talking about, but I presume you're talking about whether you're going through the menopause and things like that. Yeah, that's particularly if you're feeling like you're getting hot and flashes and flushed, then I would definitely want the room to be cool. You could talk to there are some medications that the primary care folks and OB-GYNs are putting patients on for that type of problem. But they definitely can, keep people awake and affect you both mind and your body. So I think from a temperature standpoint, you definitely want to be cool. And there are some medications that may help that, but I would talk to your primary or your GYN for advice on that.
Thank you. We have 2 kind of related questions. One person wanted to know if you could reiterate the ideal sleep length, and another person wanted to know, is the duration of sleep more important than when you sleep?
And the duration and quality are what's key. The issue is if you look at folks that work night shifts, they tend not, even though they come home and try to sleep during the day, they're not getting either the duration or the good quality. And so night shift is actually a risk, a risk for diseases and heart disease. Unfortunately, a lot of the world works at night, but I think the bottom line is duration and quality is what's important. If you can functionally stay asleep during the day, if you work night shift and you can actually get 7 to 9 hours of good quality sleep during the day, that's probably fine. The issue is many patients that work night shift are home either picking up kids or dropping somebody off or doing something, and they're not really getting 7 to 9 hours of good quality sleep. And the rest of the world is up. So they may go to sleep and they get awakened at 3 in the afternoon. They're trying to sleep till 5 or something. So the answer to that question is it's quantity and quality that's important. When you do it's probably not as important. I'm just saying most of the world is up into the sunlight and down at night. And my patients that work night shifts most of them aren't really getting good. And they admit it to me. I got nurses that work in the ER and they admit to me they're not getting 7 to 9 hours during the day. I think it's hard to do, but the answer to the question is it really shouldn't matter if you're getting 7 to 9 good quality sleep when it is.
Okay. And if the sleep is broken, like say you can get a 4-hour chunk here and then another 4-hour chunk later, is that just as good as 8 hours of sleep? Or
you want to get a total of 7 to 9. So I have patients that only get 6 at night, but they nap for an hour from 1 to 2, or they get 5.5 and they nap an hour. So actually naps increase your longevity as well. The thing is you don't want to nap late, but yeah, I tell them as long as you're getting 7 to 9 hours and it's good quality sleep, then you should be okay. But try if you're only getting 6 at night, then try to get an hour nap sometime in the early to midday.
Okay. Yeah, we do have a lot of questions here. Are there any blood tests related to sleep disorders? I think they might mean like able to diagnose them.
Not that I'm aware of. A specific blood test. You look for markers. The things we talked about in terms of markers of inflammation, in terms of your cholesterol, in terms of your glucose. These are secondary effects of the problem with poor sleep. So it's not you can go to the lab and get a test done and say you have a sleep problem. It's the secondary effects of all the different systems that are affected by the poor sleep. Svati's the expert on genes. I mean, she probably could tell us. We talked a little bit about your biologic age versus your chronologic age. If you're not getting good sleep, and we said if you get good sleep habits, men get an extra 5 years, women get an extra 2.5 years of longevity. That means if you're not getting that. So she could talk about epigenetics and looking at demethylation studies of your genes. But there's not one blood test I send patients for to see how their sleep's doing. Now, not blood tests. The test in terms of sleep apnea, there are sleep studies. I mean, sleep studies, whether you have restless leg syndrome, whether you have early awakenings, insomnia, you're not getting deep sleep, whether you have sleep apnea, that's a sleep study. Yes. So there is a test, but it's not a blood test,
Mm-hmm.
So my advice is if you're having trouble sleeping, consider talking to your primary doctor about, do you need to see a sleep doctor or have a sleep study? It's not just sleep apnea. There's restless leg, there's frequent awakenings, there's insomnia, getting to sleep. So the sleep lab is an important adjunct in terms of helping people with sleep disorders for sure. So, but that's not a blood test.
Paul, I have a question for you, and it's one of the questions that's in the Q&A. My husband sleeps 6 hours a night. I need 8 to 9 hours of sleep. So one of the questions was that there's probably a different amount of sleep that any given person needs, even within the window that you're recommending. The question is a great one. How do I know when I've gotten enough sleep?
Well, if you feel well rested, you're not getting tired at the end of the day, you got a good blood pressure, your blood sugar is good, your cholesterol. I mean, most people, and if you have a partner or a spouse or someone that can tell you whether you look like you're sleeping, restfully without intermittent waking up or stopping breathing apnea, then you probably don't need to be evaluated. If you're falling asleep at 4 p.m. or feeling washed out and tired, I mean, the folks that have sleep apnea that don't know it, when they get diagnosed and treated, they come back a month or two later and feel like different people. They say, I didn't know how bad I was feeling because I got so much more energy now. So my advice is, is everything working? Are you feeling well rested? Are you, are all these associated problems that poor sleep can lead to, are you suffering from that? If 40 to 80% of folks that have high blood pressure, heart failure, pulmonary hypertension, and AFib have sleep apnea. So the recommendation is if you have someone with resistant hypertension, probably ought to consider a sleep study. Somebody with pulmonary hypertension, probably ought to consider a sleep study. Somebody who has AFib that was cardioverted or had an ablation and now has recurrent AFib, what's going on? Why are they having problems? Consider a sleep study. So if you're having issues that are resistant hypertension, pulmonary hypertension, recurrent AFib, and someone's scratching their head, why do you have this? Consider a sleep study. Otherwise, if you're feeling well rested and you're in good shape and you're not overweight and your blood pressure is good and your cholesterol is good, I mean, move on. Life sounds pretty good. But I will say there's a very small percentage of the world that don't need as much sleep. Okay, when we were in training, when I was in training, I got 3 or 4 hours sleep. Well, I thought it was pretty good. Okay, I did that for 3 or 4 months. It didn't last long, thank God. But and we no longer do that because we're smarter now. But there is a very small subset of people that can get by with 4 hours, 5. That's like, I don't know, 1 in a million. It's very, very low, very, very low number. Vast majority of us need in the range of 7 to 9 hours. If 6 hours, okay, maybe obviously you're the geneticist. There's some genetic variation, but it's very unusual. There's a very small subset that really can get by with 4 hours long term.
I think I've heard of that. I think Margaret Thatcher was one of those people.
Yeah, some people think the president might be a president, but I'm not sure about that.
We have a couple people who've asked about melatonin. Is it recommended? Is there an issue with long-term use?
No, so melatonin is starting the race. Okay, if you have trouble falling asleep, melatonin can help you. You have your own endogenous melatonin, which is what you don't want to shut down by looking at a white tablet or getting bright lights in your eyes, because it'll suppress your endogenous melatonin. Melatonin over the counter is not bad, but you need to understand it starts the race. It puts you to sleep, doesn't keep you asleep. So if you have insomnia to the point where you're having trouble getting to sleep, which is the higher risk people, melatonin's safe, and if it helps you and it works, fine. but it's basically starting to sleep. It doesn't keep you asleep. So if you use it and you're still waking up 3 or 4 times, and can't get back to sleep, taking more melatonin is not going to help you. It's just to start the race, not to finish the race. But it's a safe drug. And the key thing is, if you're having to take it, are you doing something before you go to bed that's shutting your endogenous melatonin down? Cut the lights down, have a black background and white letters. Don't have the TV in the room. Keep the lights down, and you're more likely to be successful with your own melatonin. But I think it's safe. It's available. If it works, fine. Use it.
Great. Cecilia, how many more questions?
Yeah, probably only one more, but Dr. Campbell, could you please repeat the title of the book that you recommended?
Why We Sleep. Why We Sleep by Matthew Walker. It's Unlocking the Power of Sleep and Dreams. It came out, I think, about 2017, 2018. But Why We Sleep is the book by Matthew Walker.
Thank you so much. One more question, Brooke. I think we should be good with that.
Okay. We have several questions related to sleep apnea in here.
The one that just came in, Brooke,
Yes.
about whether improving sleep hygiene now can reverse the impact of prior poor sleep habits. I think that may be a good one to end on.
Oh, yeah, that
Hopefully,
is. Yeah,
if
sorry.
it's uplifting.
I hadn't scrolled down that far. Yeah.
So, yeah, I mean, can it reverse it? I'm not sure it'll reverse it, but it certainly can prevent it from getting worse. I'm a physician. Dr. Shah's a physician. We came through where, they said if you weren't on call every other night, you missed 50% of the good cases, meaning they wanted to keep us up all night to be, able to work. We learned that's not a great thing, obviously. So when I heard that there's an increased risk of dementia, that's what got my attention, because most of us who trained years ago were sleep deprived for many years. Is it going to reverse that? I doubt it's going to reverse it for me, but I'm going to do everything I can to try to prevent me from, try to improve my longevity and to reduce my chance of dementia. So to answer your question, it may not reverse it, but you certainly can halt its progression if you start now. I mean, it's probably never too late to start. My advice would be do all you can to keep it from potentially getting worse. You may not know you have a problem, but you can't do anything about the past. We move on forward, but at least we're not having mysterious no clues like Bob Seger's song. We do have clues. We do have information. We do know what we can do. My advice is to do all you can to have good sleep hygiene. I definitely, that slide I showed of sleep being the foundation of health. That's why I pound on my patients every time I see them. How you sleep and how long you sleep and what's your quality every visit. Because the American Heart listed as number 8, I listed as number 1. It's the foundation of health, of which everything else stands. So I do all you can going forward. I'm not sure it's going to reverse what's already gone under the bridge.
Okay, well, thank you so much, Dr. Campbell. Thank you for, this great presentation. I want to thank you, Dr. Shah, for joining us tonight too. Here is our contact information. We ask you that please email us if you have any question at OneDukeGen@duke.edu. We ask you also to keep your information updated if there is any change, so we can always contact you. And I will end tonight. Well, again, thank you, Dr. Campbell. Thank you for always being so helpful with us, and supporting us.
It was a pleasure. I appreciate the opportunity to discuss with you. Thank you.
Yeah, and thank you, Dr. Shah, for your guidance, for being with us tonight, and for sharing your knowledge as always. And I will end the webinar tonight just, as I started, thanking all our participants. Thank you so much for your participation, for your support. We cannot do the work we do if we don't have, your support and collaboration. So thank you, everybody. Have a good night, and we will see you next time. Bye.
Bye-bye.